Hello, my name is Eliana Bernal, and I'm a Master of Public Health student at the University of Nevada, Reno, and the Nevada chapter of the American Academy of Pediatrics Public Health Intern. Today, I will be sharing the findings of the Nevada Parent Attitudes About Vaccines survey in the first quarter of 2022. First, I will discuss the purpose of the survey and then dive into the findings. The Nevada Parent Attitudes About Vaccines survey was designed to assess Nevada parent attitudes about routine pediatric vaccinations. The goal of the survey was to identify and support needs regarding vaccines and vaccine education to help promote the uptake of vaccine rates and promote a vaccine healthy Nevada. The survey was open for 3 months and gave us valuable insight on pediatric vaccine health in Nevada. What we learned from the survey was that emphasis should be placed on combating misinformation online. We learned that eliminating missed opportunities for care should be prioritized in order to get children into clinics for their routine visits. We learned that Nevada parents trust their doctors. And finally, we learned that mandates matter. 3 in 5 Nevada parents have never declined a vaccine. Here, you may see some of the reasons this group of parents have never declined. While this is significant, focus should be placed on understanding why 2 out of 5 parents have declined. This warrants further study into how much misinformation parents are exposed to in their day to day lives and who might be providing that information to them. We asked parents if cost was a barrier in their child receiving routine vaccines, and only 1 in 5 stated that cost would be a barrier. 1 in 10 stated that distance, timing of clinic, or wait time at a clinic prevented their child from getting vaccinated. We learned that what might be perceived as a barrier isn't as definite as we believed. When asked about the HPV vaccine, 80% of parents indicated that their child had already received the vaccine, and 20% indicated that while their child had not yet received the vaccine, they plan to have them vaccinated against HPV. This is significant because it indicates that despite some of the controversy surrounding the HPV vaccine, providers are recommending the vaccine and children are receiving it or at least intending to receive it. When asked about using the Nevada WebIZ webpage, 4 out of 5 parents indicated that they have used the website to access their records. This is significant because it highlights the need for accurate and efficient documentation of vaccine administration into the WebIZ system. When asked about who they trusted the most for medical information, Nevada parents indicated that they trusted their doctor the most for medical information 100% of the time. This is significant because it highlights the need for Nevada parents to connect with their doctors, putting further emphasis on those face to face routine visits. Not coincidentally, parents who had face to face visits with their doctor felt that they were informed. 80% of parents indicated that they felt they received enough information about vaccines, and 20% of parents indicated that they received a fair amount of information. This again leaves opportunity to consider why 2 out of 5 parents have declined and how that might be related to missed opportunities during those face to face visits with their doctor. Lastly, we learned that mandates matter. When parents were presented with the statement, the only reason I have my child vaccinated is so that they can enter daycare, school, or sports, 50% of parents strongly disagreed, 40% disagreed, and 10% were neutral. While vaccine mandates create controversial headlines, decades of research shows that only mandates have improved public action. In our survey, parents were not willing to admit that mandates were the main driver. Going forward, the Nevada chapter of the American Academy of Pediatrics will continue to monitor the most recent research findings that show that a combination of building trust and imposing mandates is the best action to improve immunization rates. So, our key takeaways are that further studies should focus on combating misinformation online. Emphasis should be placed on missed opportunities for care, since we know that Nevada parents trust their doctors and will likely receive a vaccine if it's recommended to them. And finally, that mandates matter. Thank you.